What are some of the most exciting innovations or breakthroughs in the ophthalmology space that you're currently exploring and adopting into practice?
Yes. So one of the key things is more patient choice. So classically, for example, let's say cataract surgery. In the NHS, it was available. You'd have a lens fitted for you, which was going to be able to give you great distance vision. But normally, people were still relying on glasses afterwards for middle distance. So kind of your computer screen work as well as your near work. So exciting, things that are happening in lens technology are that lenses which give you both far, middle, and near vision. So nearest to what your natural eyes can do, these lenses are becoming more and more available. They're not suitable for everybody. So hence in the NHS, when you go for cataract surgery, still in most hospitals, only monofocal, which is the one distance vision cataract surgery lens is offered. But privately, we can offer these other lenses, which give you, some people want to work better without glasses, both near work as well as for computer work. And some people, for example, like pilots, etc., you've got to be careful because they need specific lighting conditions when they're flying. So what we like to offer is a kind of tailored approach to patients, offering them the best lenses for their day-to-day activities. So what's really becoming much more of a kind of an emphasis in today's kind of practice is patient occupation, patient hobbies. So we love to hear from patients what they really like to do, and then we need to tailor our surgery to the patient's needs. So that's an exciting area.
With so many medical clinics offering similar services, how do you differentiate your practice in a way that's ethical, compliant, but still compelling to the patient?
So yeah, a really great point. I mean, in today's environment is amazing for patients. So patients are getting a huge amount of choice. Lots of independent treatment centers coming up, which are driving down waiting list times of the NHS, for example. Lots of great specialists out there. So for me, what is a defining factor? It's really important for the patient to know that you have consultants that are skilled in one area of, let's say, specialism. So you have an ophthalmologist, an eye surgeon, who only does glaucoma surgery, who only does retinal surgery, or who does cataract surgery but doesn't do any general ophthalmology. So one of my, I suppose, what do I offer? I still work as an NHS consultant as well as a private consultant. So having my feet in both of those worlds really allows me the opportunity to offer quite a balanced approach to my patients. So I'm not sitting there because I regularly speak with patients who don't pay for treatment. I also want to offer them the best care that I can under the remit of NHS. So when they come to me, I think one thing that they can be really reliant on is that I will give them a very balanced, non-sales orientated approach to my eye consultation. So for me, the most foremost important thing is to do the right thing for that patient's eyes, to do the right thing for that patient. And I regularly, for example, will promise my private patients, I will say to them that, look, one thing you do realize that you've got the option of having this addressed on the NHS. So it's good to be upfront with patients. Although you've got a lot of choice, what patients can get from me is you're going to get a very honest opinion. If they ask me an honest question, and patients will typically ask me, if you were a patient, if Mr. Grewal, if you were an eye, if you were going to get your eyes done, what would you do? And I think that's a great question because it certainly puts the consultant, really there, and he's got to kind of speak from his heart as well as his mind. And I give that regularly to my patients. I will tell them, and I'll tell them in a way that they can understand. So the other thing that for me is that they won't get a jargoned approach to their consultation. I know you've got really intelligent patients out there who have got no medical knowledge, right? Long gone is the kind of age of hiding behind terminology, hiding behind medical terms. So what people can expect from me, I suppose, is a honest and a very direct approach. Many of my reviews will say that patients will say that he speaks very directly. He doesn't kind of wishy-washy around, and it's because I really want to offer you advice like I would to a family member. For me, if a patient walks away from me, and this is quite an important for me, if a patient walks away from me, for example, and doesn't want to have treatment with me, I don't look at that as a loss. I don't look at that as a something to be, taken as a negative, because I commonly will talk to patients. And for example, I'm not a super retina specialist, for example, and I will see a patient, I can diagnose a problem, but if I can see a person who can do a better job than I can, I will direct them to it. So I think that integrity is what the key, I suppose, one word, if you were going to use it, they can expect from me: integrity in my approach to helping patients.
In the healthcare industry, where it's kind of blurred lines of like how you can use testimonials and patient data, and you can't really make any exaggerated claims compared to, say, other industries who do that a lot. How do you actually communicate your value to potential private patients effectively?
Yeah, I think that's a great question. I think one of the reasons why I've reached out to, you guys in allied healthcare is that you're you're balancing your publishing or your advertising, and your niche is healthcare. And you've said it already, that there's lots of people selling products everywhere. There's lots of people selling gadgets, for example. But when it comes to health, in healthcare, we need to be sensitive. We definitely can't be seen to be overselling. And in healthcare, in medicine, when we train, we never get taught how to advertise ourselves. In fact, most doctors and me alike, we're not that great at always using social media to put our platform across. And also, social media can be a little bit dangerous in terms of, if you're poor at putting yourself out there, or if you're poor at what content you should be putting out. Again, we reach out to specialists like yourself. So that's one of my reasons for reaching out to you. I didn't want to overstep the mark. I'm a doctor. I'm an eye surgeon. That's the job I do. But it's also trusting other people in the area, and I definitely don't want to be somebody who overstates my position in the field. I would say that I don't really have claims that I'm the best consultant out there, I'm the best eye surgeon out there, because frankly, I'm not. I'm somebody who holds to my values. I practice, I have regular yearly appraisals. I work in the NHS as well as privately, and all of my surgeries are audited. I enter all my figures in my appraisals. So one thing I suppose is I've got accountability as a doctor in my appraisals in NHS and private work. That would speak for itself. But also I've got a commitment to continue to learn and update my knowledge, right? But I said your question was very much, how do you get the word out there? I think we really either do a bad job by kind of, creating a kind of mini website and using Facebook and all these kind of social media that we don't really understand, or we reach out to yourselves and we say, look, okay, give me, can you portray me in what I am, in my, as I said to you, one of my buzzwords for me is integrity. The other one is not to be chasing financial rewards. That's not why I went into medicine. It's not why I practice privately. I practice privately because I feel that the private work and the NHS complement one another. I can't offer everything that I'd like to offer to my NHS patients, and the private world is really an area that I can offer that. But I'm not here to make a quick buck and get out of the industry. For me, the respect, professionalism, and really holding on to my integrity, which is my kind of core value as a human being, to my fellow human being, that's a really important area. And I want you, I suppose, allied health media, to really be able to get that message out for me. Me, if somebody wasn't coming to my room, they didn't know where my consulting rooms are. They didn't know where I practice, right? I'm kind of asking allied health media to give me a thumbnail out there in this big kind of world of media, but an honest one, so you can see, I don't dye my beard. I've got my white hairs out there, and I don't really glue my beard down because I'm a Sikh, right? So there's also not, I don't create a facade around me. It's what I have, it's what people are going to see when they walk in. So I may as well show that through the media as well. So I really need your help to put that kind of message out there.
Yeah, absolutely. And also, like, with the growth of your prior practice, sometimes I feel like just on a personal level, because I feel like, well, obviously a lot of doctors speak about your clinical life and business stuff and so forth, not with so much their personal stuff. And even though everyone has the same challenges and has to overcome that, so I would ask you about that. A lot of people find it useful as they are sort of building their practices, and they maybe look to you as inspiration. But practice growth can often come at the cost of personal time, personal sacrifices. How have you managed to stay balanced as an NHS person, a prior business owner and, a family man as well?
Yeah, a great question. If either one of those pillars fall apart, if your family life's not right, it's going to leak into your work life, and vice versa. So one of the areas was that when I started off in practice, I was devoted towards my NHS practice alone for many many years. And when I joined my NHS trust, I didn't join private practice, and one of the reasons was that when you become a consultant, there's lots to learn. You're learning both in terms of running your own show or your ship, as people like to put it. You've got to devote a lot of energy into setting your protocols, setting how you like things done. So I did take that time at the beginning of my consultant career to just have devotion towards the NHS. And then I was fortunate in my NHS work that I was able to condense it by doing quite long days in my NHS work so that I had periods free for my family work. So when my kids were quite young, I was pretty much helping out with at home as well. That kind of a situation where I wanted to enjoy my children, right? So why did I have a family? It was to enjoy children's. So one thing I can share with you is that I actually took a consultant job up in Scotland while my family, just because I wanted to become that fully fledged consultant, and my wife said, yeah, go ahead. But guess what? We can't move from London. So I had a couple of years where I was just an NHS consultant working in Scotland and splitting my week between Scotland and England, right? For 2 years, I managed that, but I realized that I was missing out on a huge amount of my children. So what I had to do was make the difficult decision of a really beautiful place that I worked at in Scotland, great staff, great people, but I had no family, right? So one of the things that I did was take that conscious decision that I'm going to resign from my NHS consultant job in Scotland and I'm going to come down so that I can become family and a human being, right? Human beings, we need support. We need family support. We need our spouse. We need our family close by, right? So my parents and my wife, everybody were down here. So I came down and I sacrificed career, if you like, to come down. I worked for a bit as a locum consultant, and then I got my consultant job down here. So, but I took that bold decision. There was no point being unhappy personally and having a really rewarding professional career. I don't think the two marry up very well. And if they do, people are much better than me at organizing than I was because, you can't split yourself, right? So finally, I got it to a great situation where I had my NHS consultant job. And again, I was lucky to get that condensed into 2 or 3 days. Then I had time for my family, especially when they were young. And when they got a bit older, when they got to teenager years, when they got their own friends and their own things to do, and my wife didn't need as much support, I started to branch out into private practice.
What is your general advice for, new starting up private consultants who are transitioning from the NHS to start up their private practice? Can you walk them through sort of what differences that you see and how to navigate those initial few months and few years?
And I think it was a kind of first you when you do private practice, you kind of feel you have to be everywhere, right? So I was in West London, I was in Harley Street, and I was in East London. And I clearly put my ring right out there. But I was sometimes traveling an hour or 2 hours to go out to a place to see one patient, right? So, so I did all of those things that everybody else does in the private career. But eventually I worked out that I need to have my consultant clinics pretty much close to where I live, close to where I am, so that the travel time is cut. So what I feel is I've kind of organically learned and gone through the process. But I think people who are interested in private practice and doing it well need to understand that, don't grow too fast because when you grow really, really fast, sometimes you're then starting to eke away at the time you've got for your patients. So commonly, patients with me don't feel rushed. And the reason is that I make my appointments such that they're not going to feel rushed to give their answers or to get that treatment in place. So commonly I will sort of talk to patients and I'll say, look, guys, don't feel that you have to sign up to surgery. Don't feel that unless you've understood this really well. Let's work on it and we'll have a follow-up consultation. So eyes, it's not like making a decision about even buying biscuits or, buying clothing or, I'm buying a car, right? This is your eyes. This is a part of your body. And no decision really is there a decision in eye healthcare that you have to make right then. And whoever's pushing you as patients to make your decision quickly, and you've got to kind of step back and take ownership of your own health. So what I still put out to patients is this is not paternalism, right? This is not a situation which it was in the 1960s or 70s or even 80s when I first entered into healthcare. This is now the patient needs to really own their health. So I allow patients that time. And I think just as the time I would allow patients to make that time, and I don't force decisions. I don't force time. I don't let time dictate what the patient needs or the decision. I let the patient know, and I let the insurance company know, and we'll make that decision organically. I think a very wordy answer, but I suppose I'm trying to share one of the reasons I never finish my clinics on time, and I'll give you this. So commonly, one of the people, it's common for me to allow enough time for patients that my clinic will go overrun. Now, some people would look at that as you're inefficient, but I look at it differently. Most of my patients give a very positive feedback. And the reason why they give that is that I give them that time and that space. And I apologize to a patient afterwards, or, for example, if there's a delay, but I say, just as the patient before me got that time, you're going to get your time as well. So I'm very honest with that. But patients need to also understand, one of the things I would say to people, just that there is a charter for rights. There's also a charter for responsibility, right? So patients have rights, but they also need to take responsibility for their own healthcare. So I do put it out there. I say, no, 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 this is your eyes, right? My eyes are different to your eyes, but this is what I would maybe do in your condition, but nobody can be you. No, I don't do your job, right? So I think I always push that out there as well, and I make the patient feel that responsibility as well as the rights for their healthcare. So it's like people are not surprised. They want the doctor sometimes to make the decision, and I say, no, really, I want you to be happy with your decision.
If it's not your private medical practice all over again from tomorrow, same skills, but no patients, what would be your first three moves?
Okay, yeah. So my first move would be, I think, location. Ideally, within a half an hour of your ability to get to that private practice if there was any issue that occurred. So as I may have mentioned earlier, when we start off, you join everywhere and you go for private practices everywhere. And you'll see that commonly with new consultants. Wherever they can get their foot in, they will, because there's a fear, right? I need to be everywhere. And but what I would say to consultants is it's much better to build a good reputation from one regular place or one or two regular places, rather than having your foot in four or five different practices where you're going to find it very, very difficult trying to get out there, travel time, trying to get the system's representation, your own representation within four or five different localities. It's hugely difficult, right? Whereas if you pick your place, if you pick where you're going to be able to get to, and I would say the magic number is about half an hour in London. London is great for travel and transportation, but 30 minutes is a good time, right, for eyes. That if you've done a surgery and a patient needs to be followed up, you can get there within a half an hour is a very good principle, right? The second thing is don't join lots and lots of different practices. Start at one or two practices, build a good team. Team is, look, your private hospital is not going to belong to you, right? You're going to have colleagues there. You're going to have a local other than your speciality. For example, I'm an ophthalmologist, but I work really closely with ENT consultants, plastic consultants, dermatology consultants, rheumatologists. So ophthalmology is great. It really bridges the surgical and the medical world really, really well. So you've got to establish a rapport with local specialists who you're working with. Also, your local GP practices. Now, it doesn't matter whether you're writing a letter to a patient after seeing them in the NHS to GP practice, or you're writing them privately, because everybody's GPs on the whole are informed, right? So you've got to try and establish a good integrity and good, let's say, footprint locally. And I would say once you do that and your practices and you're doing really well and you feel that there's an appetite for you for your work elsewhere, then step out. But so that would be my kind of magic, couple of tips. Really, keep it, build strong, and then build from there.
With so many medical consultants within the field, and patients, are speaking to multiple different consultants to get an assessment on their problems. How do you navigate those conversations with patients come to you, having said they've already seen a bunch of consultants and now they're asking you? How do you navigate those scenarios?
Be very careful about overselling yourself, right? Um, because of my nature and my spiritualism, I'm a Sikh by look. One thing is integrity, right? So I once had a patient who came to me and said that an eye surgeon colleague of yours has referred you because they say you've got a good pair of hands, right? And, it's meant to be a compliment for a surgeon when somebody says that you've got a good pair of hands, right? And I said, yes, I said, when they told me the name of the consultant who sent you, I said, well, you know, I would actually say to you that the consultant who sent you has probably even got a better pair of hands than I have. And I didn't make it as a false. I knew the consultant that had referred, and genuinely, the consultant, I'd seen them operate. They were fantastic. But so it's always good sometimes to not just accept a compliment, because a compliment, whenever you over compliment somebody, you raise them on a pedestal. When you down talk, and I think the reverse is also important for my colleagues out there, it's always important that when a patient comes to you and speaks about another consultant, another colleague, you may not even know them, right? And they may say something negative. I think you've got to be really careful and not bite that cherry yet to start launching into a conversation about that. This is typically what I'll say to a patient. I don't know what your experience was with this other consultant, but to be honest with you, they're also not here to give their representation, and I'm here to care for you, right? You've chosen to come and get my opinion now. So whatever they've told you, etc., if we spend all of this time in my consultation discussing what they have told you, then you're gonna waste your consultation time, right? I have respect for you, and I'm sure you've got letters from my colleagues. Let me have a look at your eyes and let me give you my honest opinion, right? And I'm not, and I think I leave it to you as the patient to decide what you want to do, right? Because you could go to four people and give them and tell them all the same spiel, right? So I think what I would say to my first of all to my colleagues, my young colleagues, and the older colleagues probably know better than I do. You don't launch into negative conversation about other consultants. Equally, you don't build people on pedestals and you don't knock people down. And equally, I would say to my patients, look, have respect for one thing. Whichever colleague you've gone to, they've done their training, they've done their specialism, and you, for whatever reason, just like you don't get married to every person you meet, right? You take time. You take time to. I met my wife many many times, and my wife wouldn't have just married me on the first meeting, right? So equally, I'd say it's a relationship. Sometimes people's habits, people's personalities gel with one another better than others. And I think it's the same with patients, right? So we're human beings, and one of the things that I'd like to mention in the world of AI, and I know AI is everywhere, and I think you can't beat that human domain where, and in healthcare, the humanity aspect is this: be humble, know your shortcomings, know where you're weak. I know where I'm weak in which areas of surgery I wouldn't go into. I know which areas there are better people than me to treat you. But what a patient can definitely expect from me is Dr. Jasvir Grewal will refer me to the best person he can refer me to. If he can't do the surgery, he will refer me to someone better. And I think there's no better compliment that I've received than when a patient's come back to me and said, I'm going to thank you, Mr. Grewal, for where you referred me, you know? And I don't take that as a slight. I take that as a positive. So yeah, that's one thing.